Thank you for joining us for session 2A. I know if you're like us on staff, you're probably feeling motivated and inspired by the amazing remarks from our award recipient, Mo Stewart, and our other volunteers who joined for the last panel. So with that, I will just go over a couple of housekeeping items for today's next session, and then we'll turn it over to others on my team to go through some exciting advocacy training. So again, if you're just tuning in now, please, if you have any questions throughout the presentations, just enter them into the Q&A box. Closed captions are available for today's session. And if you have any technical difficulties or need help accessing something, please email us at npafevents@npaf.org. And again, please enter into the chat your name and where you're from or what organization you're coming from, because as you know, this is our volunteer community, and we'd love to meet and see where the rest of you are from. And again, we will be having our chat on social media. So if you'd like to join the conversation there, just use the hashtag HealthNeedsNav to join that. And without further ado, I'll pass it off to my wonderful colleague, Melissa Williams.
Thank you, Nicole. Hello, everyone, and welcome. Thank you so much for your patience as we worked through some of the technical issues to get this session going, but just wanted to take the time. You are not going to hear much from me today. You are going to hear from Martin Diego Garcia from the campaign workshop. NPAF has had the distinct pleasure of working with the campaign workshop over the past year, Martin and his team specifically, and they have helped us execute our campaigns. And we thought, what better way for our volunteers to see who has been helping support us by having Martin facilitate this session today and conduct this training on the importance of stories and advocacy. And I love that the last panel that featured our volunteers really helped set up, I think, this training. And so I hope you all will get as much information here to guide your advocacy. And so Martin, I'm going to turn it over to you now. Take it away.
Fantastic. Thank you so much. And I'm super excited to be here with all of you and also have the distinct pleasure of working with the team over at National Patient Advocate Foundation on a number of the campaigns that I would imagine you all have had your hands in working on. And so thank you for all of your involvement in those. I get to do a lot of the behind the scenes creation of some of the toolkits and some of the information that you all get to see. But it is always exciting to talk to the folks who actually get to use them as well. So super excited to be here. Today we're going to be, folks over at NPAF have asked me to talk about storytelling and how a lot of movements, groups and organizations, advocates have been harnessing the power of storytelling in a very particular way in order to move folks to action. And so the approach that the team that I have been working with, we've been thinking through in terms of how they are engaging and activating you all as advocates and activists in the healthcare space is really to start building this groundswell of support from your friends, your family, your neighbors, your communities, to really have a larger voice when we come to legislators, policymakers, organizations who hold sort of the decision-making power there. And so what we're going to do today is walk through how you all should be thinking about utilizing your own personal story. I'm going to give you a pretty easy framework in which to structure that. And then we can and talk about how you all may be utilizing that, not only in the Health Needs Navigation campaign, but in campaigns to come. So if we can start the slideshow, please. Fantastic. So as I mentioned, today we're going to cover sort of why storytelling, why it's important, how folks are using it, and sort of just the thought process behind how we utilize storytelling. I'm going to then really specifically talk about how you all have probably maybe seen storytelling utilized before, and the difference between the sort of anatomy of storytelling I'm going to give you for this particular type of storytelling in advocacy. And then I'm going to talk a little bit about how you can utilize that storytelling in the advocacy work you're doing, whether that's recruiting other volunteers, whether that's lobbying policymakers. And then lastly, I'm going to give you some examples and a little bit of a storytelling workshop of actually one of your own folks among your volunteers here who has already done this for us in a video. And I'm going to be able to show that to you all to see how you all can actualize that with your actual work and your stories. So I'm going to talk about why stories. So give you a little bit of context in terms of why is it important that we actually utilize storytelling. So first and foremost, stories really ground us in our values, in the way that we tell stories, in who we highlight in stories, in the words that we use, in the types of stories that we tell. It really shows the type of values that we hold as individuals and NPAF holds as an organization. So most often, our stories likely involve our experience in the healthcare system, our experience as caregivers, in interacting with that healthcare system and ensuring that people have access to it, right? Ensuring that it is equitable, ensuring that it is inclusive, ensuring that folks are able to navigate it in a way to get what they need as a person and as a patient. And so all of those things, and when you're telling come through in your storytelling and really show folks what you value as an individual. And so when you're thinking about storytelling, we often go to, particularly if we are super steeped in the content, right? We'll go to the policy talk and really like into wonk wonk land. We'll go into like the weeds of the healthcare system, which get like super complicated and have like really complicated words, right? And so once we start doing that, folks really start to glaze over because they're not relating to what you're trying to tell them. So the second reason that we really use storytelling is because we want to make sure we are emotionally connecting with the folks who we're talking to. I would really like to believe that we as humans make all of our decisions with our logical brains. That doesn't happen as often as we think it does. And we know that we individually, and we know that folks really connect to emotion and usually respond or react to emotion in a much more stronger way. And the information that we're telling folks that has an emotion behind it really resonates and is remembered more in the long term. And so when we think about storytelling, we want to remember the reason we're using it is to try to connect emotionally with our audience. The third reason is because we're actually wired for them. Stories have been used by communities for centuries to pass down history, to pass down information, to teach morality, to teach education. From when we are children. Before we're even in school, we're reading our children or reading our children books that all usually have some sort of lesson in them. And so people are already ingrained to understand, retain, and learn new information through storytelling. Whether it's books or movies, whether it's music, people really connect to the story and to the journey. And so that's where we want to really hone in when we're trying to share this information to get folks to communicate with us. Because the last reason, right, is facts are just facts. We can continue to throw out numbers and throw out facts to folks, but the more we throw those out, it starts to dehumanize the issues that are really important to us and the issues that we're working on, and makes it all about numbers and data rather than the actual stories and the impact that the system is having on actual people. And so just think about the COVID-19 pandemic. In the beginning, it was about stories of individual folks because there weren't that many cases. And once the numbers just started skyrocketing, it was all about infection rates and hospitalization numbers and death rates. And it was just numbers, numbers, numbers. And the numbers just kept growing. And at one point, even myself sort of just was like, I can't comprehend that because I can't see that number that big. And until they started coming back to start really individualizing it, and whether it was in the news or in regular conversation, people started talking about people they knew who had contracted COVID-19, and it brought that human aspect back to the conversation. And so remember that we want to make sure that we're putting a face to everything that we're doing, and facts can only do so much for them. They are still important as evidentiary support, right? We talk about the one case and then we say, this case is happening 100,000 times over in the country, right? And then it sort of gives that context to connect the dots for folks. Well, that's really why we hone in on storytelling and why they're so powerful to utilize. What I want you to be thinking about when you're communicating to folks and you're utilizing storytelling is think about the head, the heart, and our gut. Very often, like I mentioned, we often go to the head and we talk about facts and figures, we talk about evidence, we talk about policy, we talk about really stuff that's really in the weeds, and try to just give folks facts because we think when they hear the facts, they're going to automatically come to the conclusion that we need them to come to. If you have been living in the United States in the last 2 years, that's not the case, right? So facts aren't something that everybody sees in the same way. And oftentimes when we talk about a particular issue, whether it's healthcare, whether it's education, whether it's social justice, right? People in their brains and in their logical brain often already have a set opinion on that particular issue, right? They'll automatically be like, oh, I've already heard this and I know where I stand on this particular thing. Whereas if you really focus on the gut and the heart, we're able to open up that conversation a little bit more and get a little bit deeper with the conversation. Because the gut is really that physical reaction we have to something when often we see unfairness or injustice or something we just in our body know isn't right, and or something we feel in our body because it's impacting us or our loved ones, right? So think about a parent who has their kid in school. I know my mother did this for me all the time. When I came home and just like nonchalantly mentioned something that happened at school that she didn't think was right, trust that my mother was in the principal's office talking to the principal about why I was experiencing these things in school. And it's because she had that gut reaction to what was at stake. And what was at stake was my future and my opportunity and my access to reach my full potential, right? And so when you think about the gut, you really want to lay out for folks what is at stake in this particular problem or this particular issue. If we don't embed health needs navigation into the healthcare system, people, I mean, at the worst case scenario, we will lose lives, right? Unnecessarily, because people don't have access to the resources that actually exist out there to help them get through what is their need, whether it's mental, financial, or social needs, right? These resources exist. And if we don't connect them to the right people, people might die, right? And so that is what's at stake. And so you want to really lay that out clearly so that people really feel that visceral reaction to be like, okay, I get it, I feel it, I want to do something about it. And you also want to ground it in the heart, because in the heart is where our values live. And that's the values around justice, around fairness, around accessibility, around family, right? What is the value behind the story that you're telling to connect with the people you're trying to talk to? Because when we start talking about values and at the sort of common ground level, we're not going here. We're not going to the brain and to the head where people already have a set stance on something. And we're going to the heart to say, well, don't you think that your loved ones, your neighbors, our community should have a responsive healthcare system so that we all have access to it? I can't imagine a lot of people are going to tell me no, right? Because we're talking about just access, right? Like people should have access to these things. And so when you ground it in a frame and when you frame it in a values framework, it's much easier to sort of open that door that may be closed if you go strictly to sort of policy or issue-based work. So the next thing you want to be thinking about is the goal, right? And the goal is going to change depending on who you're talking to. So if your goal is to recruit new volunteers, if your goal is to talk to healthcare providers or needs navigators in your community to get them on board with sharing the resources, If you're talking to a legislator or lobbying a legislator on policy, the goals are going to change, right? And so you want to be thinking about, okay, if I'm talking to my community to recruit new volunteers for NPAF, I may frame the story one way, versus if I'm talking to a legislator, I may frame it a different way. So to the volunteer, I may say, here's my story, and what I really need you to do is join me, because I know you have a similar story, in advocating for health needs navigation embedded in the healthcare system. Whereas if you're talking to a legislator, you may tell your story and say, constituent of yours, and I really need you to vote for this particular bill. This is the thing I'm trying to achieve by telling this story. So as I mentioned before, you all have been doing, sorry, did I freeze up there? Back. I was just saying in the last slide, just know the goal that you are trying to achieve, because it'll help you understand the story that you want to be telling, and it'll help you formulate what I'm going to get to in just a minute, which is going to be the ask that you're trying to get people to take. Now, ways to use your story. Some of you may be familiar in your volunteer experience with NPAF in doing some lobbying and some humanizing. And what I mean by that is you've gone to talk to legislators and you've used the hook, line, and sinker method, right? Where it's very specific and it's very succinct, because legislators don't have a lot of time, and you want to get to the point, and you want to get to the reason why you're talking to them. And so it's a very rigid structure that allows you to get the information that you need to get across to the legislator, because they need to take a consequential vote. Fantastic, really great for lobbying. You also may have done the humanizing piece, which is the medical narrative, right? Where you actually just put a human face to the complications that exist within the healthcare system by sharing your personal experience of how you've interacted with the healthcare system. Also a great thing, also a super great tactic. What I'm going to be talking about today is the educating piece, which is a lot about what the Health Needs Navigation Campaign is and is going to be as it continues to grow, is just educating folks that this actually exists, right? And what is it, so that they know about it, so that then they become advocates, so that they're also humanizing and lobbying legislators, right? And so I'm going to talk a lot about how to use your story in the advocacy sense to move people to action. So as you think about your story, I want you to remember these three things. I want you to think about, what is the challenge that you faced, right? What is the problem, or what needs to be protected in your story? And you want to make sure that this challenge isn't super just individual to you, but is something that maybe is a collective challenge, whether it's a collective challenge among the type of community you live in, whether it's geographically based, whether it's the type of patient or care that you're receiving, right? What is a collective challenge that folks in your story can relate to, right? So I may not say something like, well, my specific situation, I was not able to access this healthcare because of my employer's insurance and because of the work job that I specifically work at. But like, that problem is very specific to me. Whereas if I were to say, not a lot of employers are providing a sufficient enough healthcare benefits, and I'm one of those folks, and this is my story, then I'm broadening that challenge to a lot more folks whose employers are not providing sufficient benefits. So you want to think about, what is the bigger collective challenge, because you want to state that very simplistically at the beginning of the story, so that if I'm an audience member listening to you, I'm going to be like, oh yeah, that's me. The second piece I want you to think about is, what's the choice? And this is really important, because if you don't give folks a choice, they're not going to know that there's an action that needs to be taken. So this is the place where, again, where we talk to the gut. So if the challenge is, let's lay down the value, right? The value is everybody should have access to healthcare, and some employers are not giving that to their employees. Whereas the choice is really the gut. What is at stake if employers don't give those benefits to their employees? People don't have healthcare, right? Emergency rooms get filled up. Again, the loss of potential life unnecessarily because these employers are not providing sufficient health benefits. If we're, and the choice becomes, if we're able to take action and require the state to require employers to give their employees sufficient health benefits, then these people, we're not filling up emergency rooms, and people are not going into debt because of healthcare bills, and people are not missing out on rent, and people are able to put food on their table and feel secure that when they get ill, that they have a medical facility that they can go to, right? And if we don't, emergency rooms are going to be filled up. People are going to have so much debt. They're not going to be able to pay rent or put food on their table. And potentially we will lose some lives unnecessarily. So you want to give folks that really distinct choice so that then you go to the call to action and you offer them an opportunity to join you in action. And you want to say something along the lines of, and that's why you should volunteer with NPAF, because we're working on this really cool campaign right now to require employers to give employees more healthcare benefits. And we need to do it now because there's a bill up for a vote in the state legislature, right? So you want to give them, what is that opportunity that they can take action? Because you connected them in the challenge, you connected to their value. When you gave them the choice, you told them what was at stake so they have that visceral reaction to want to take action. And then you gave them the opportunity to actually take that action. So as you're thinking about structuring your story, this is the structure I want it to be in. What's the challenge you faced? That's a collective challenge. What's the choice you're offering folks between, if we take action, here's the sunshine and roses, and if you don't take action, here's the doom and gloom, right? So that when you do provide them that opportunity to take action, they're right there with you, hoping to take action alongside you. So we had a video here that we're going to play, but I am understanding that the audio is not coming through. So Melissa is going to drop the link to this video into the chat. It looks like it was dropped. Thank you, Melissa. This is a video that Jimmy Kimmel did, and I would like folks to look at it later and think back to what we talked about and see if you can identify the value behind the story that he's telling and the challenge, the choice, and the opportunity that he lays out in this video. It's a really heartfelt story about his son and his son being born premature and having some medical conditions, and the challenge that he faced with the medical industry, and really relates it to votes happening in Congress and what action can be taken. Take a look at this. It's a really great example of how to tie these pieces together in a really simplistic way, particularly when there was a lot of medical terms that he was throwing out, but explaining in a really simple way. It's a good example of what I'm talking about in terms of the storytelling. The other thing you want to think about, and here's just some tips as you think through your storytelling development, is you want to be authentic. You want to be authentic to who you are and who the audience is you're communicating to. Because people these days, whether it's because of media or YouTube or social media, are a little distrusting of the news right now. And so the way in which we can communicate to folks and really cross that bridge of distrust is by being as authentic as possible. And sometimes that means being vulnerable. And being vulnerable takes some strength. And so I want you to think about, as you share your stories, some of them may cause some emotions to come up for yourself. And so you need to be prepared, practice, and processed through those emotions to be as authentic as possible. And to share those stories and what is important specifically to you, because again, the more emotionally connected we can be, the more powerful our stories are going to be, and the more they're going to resonate with the audiences we're talking to. And so I encourage you to, for as much as you can, be as vulnerable as possible with folks to really show them that, like, the healthcare system doesn't always help sometimes, and sometimes it's harmful, right? And what does that mean to you and your story and to the audience you're talking to? So for as much as possible, stay in that sometimes uncomfortable vulnerability space. Also figure out how to paint a picture, right? And as you look at that Jimmy Kimmel one, he shows a couple photos in it, and the photos say 1,000 words, right? And so what you need to do with your storytelling is help paint those pictures as well, so that you're taking folks on a journey and you're really taking them there, right? I think so practicing what I preach here, I'm going to be a little vulnerable with you all right now and talk about my mother. She just thankfully won her third bout of cancer, a fight with cancer. She had breast cancer for a second time, but it is her third time with cancer and has just gone through some really, really tough treatment over this last year. And one of the amazing things that we were able to do was go get her fitted for a wig because she lost her hair. And so it was fun because we got to do this really fun moment. Me as her gay son who loves drag queens was able to sort of take her to a wig shop, and we walked in and there was all these wigs everywhere, and there was this lovely older woman who sat her down in front of the mirror, and we got to try on these like big fun wigs and these color wigs and these short ones and these long ones, and try all this different type of hairstyle that that she had never had before. And so we got to really have a good time and make light and fun in something that was really sort of hard and terrible. And if these and that wig place gave discount to folks going through chemo treatment, and so we now donate to that particular organization who is helping contribute to women who can't afford really expensive wigs when they're going through chemo treatment. And so it was just a really amazing moment in that really hard journey that we went through, that we were able to connect on as mother and son. And so when you're telling the story, you want to think about what are the things that I can do to sort of take you there, right? And so my mom sat at the mirror and we were able to try on these like really fun wigs, and they were all different colors and different shapes. And there was this older woman there, right? So you want to give a little bit of that description in your story so that people are then sitting there with you. And then give them a little bit of that emotion and paint the picture with that emotion so that people sort of see where you are. Because again, through the storytelling, we're going to take folks on a journey with us. And by using those sensory details, whether it's smell, sight, what did you hear when you were there, right? Like we were able to laugh a lot. So there was just a lot of laughter after a couple of months of some really sad times, right? Using words and sensory details like that really help paint a picture and give a lot of color to a story. So think about those details in your story as well. Here's the most important part, and I think the part in which is going to make this super powerful for your all's storytelling development. And it sounds like from what I heard from Melissa that the session before this, so you got to hear some of these transformative moments. Your transformative moment is going to be unique to you, but it's the moment in which you said to yourself, I'm not just going to sit back and let this happen to me or others. I'm going to actually step in and take action to change this so that for myself, or my loved ones, or for other folks encountering a similar situation, it's going to be a little bit easier, where it's going to be a little bit better, where this can't stand because it's just not fair, right? What was that moment for you that allowed you to go from sitting on the sidelines to playing in the field and to taking that action? And it could be the first time, right? It could be the first moment you were like, I just felt lost and I didn't know what to do. And then I found a National Patient Advocate Foundation and decided to volunteer and see what I could do, right? Like, or it could be later on in your journey and be like, I was volunteering for a long time, and then all of a sudden this thing happened, which made me really step into a leadership position. And then I was on every call and doing every campaign and like really honing, like really doing the work in my community. So think about what is that powerful moment that transformed you from being somebody who was impacted to somebody who was like taking action on it. Because when you focus on that moment in your story, you're allowed to show other people that it's possible to do, and it's not some huge mountain they have to climb, but it's signing up for an email list. It's posting on social media. It's talking to their friends and families, their neighbors, their community, folks they already engage with. And then little by little, we build up their leadership and their confidence. So then they're talking to their city council, and then they're talking to their state legislature, and then we have them lobbying in front of Congress, right? Like we build them up so that they start to take little by little actions and get much more involved. And that transformative moment helps them see that opportunity for them, right? And it can be placed in, again, that challenge, choice, and opportunity as you're recruiting for volunteers. And I think this is the part that sort of sets it apart from those other two types of storytelling that we talk about, where this talks this talks a little bit less about sort of your experience with the medical or with the healthcare industry, and a little bit more about individually, what was that thing that flipped the switch for you, right? Because it's much more about taking the action to fix the problem than it was about the problem itself that actually exists. So we have a video that I'm going to show you now from one of your volunteers, Nicole, who we trained up on this last week and was able to quickly put a video together. And so I want to share that to show you all how she was able to think about the challenge, the choice, and the opportunity to move into action while focusing on that transformative moment.
Hi, my name is Nicole
So
Davis.
we can go ahead and play that.
I am a board-certified patient advocate and a resident of the state of Ohio. So one of the overarching challenges that I found myself navigating at one point or another in my journey so far as a patient advocate, and as a healthcare professional is the question of affordability of care and health insurance. So at multiple different points in that journey, I've been the patient that had amazing health care and didn't have to pay for immediate treatment. I've been the college student trying to manage a chronic health condition with no health insurance, and also as a patient advocate trying to help other people understand this complex world of insurance. So I realized that there were a lot of problems that were systemic and that could not necessarily be fixed in a doctor's office. So the way that I decided to go about improving upon those challenges and alleviating some of those disparities was by getting involved with healthcare legislation and health policy. So this is actually a field that I feel like a lot of patients don't necessarily utilize. In working with your legislators and partnering with organizations that have amazing policy agendas to improve health outcomes in your community, or to improve upon the criteria for aid and all of these other services that would make affording your care easier. I've been very blessed and very fortunate to be in a space where talking about your story and telling other people about your challenges and what worked and what didn't work is actually a thing. And as amazing as these platforms are, working with organizations like the National Patient Advocacy Foundation as a volunteer allows you to have a different type of platform and be on a different type of soapbox, if you will, in front of the key decision makers in our country. So I would urge anyone who is interested in doing this, or just interested in letting their legislators know about their journey and the things that they've learned to make the course of healthcare easier in the future, to definitely get involved with the National Patient Advocate Foundation, as you will totally learn a lot and you'll impact so many.
So, and that was only after about a 20-minute prep session. Nicole was able to put together that really amazing and powerful video where she talked about sort of her story, how she was impacted by the healthcare system, the different roles that she has played within it, and then give you that opportunity, that choice, right? She was like, I was able to make the choice to go into this field, which because a lot of folks don't know about it. And then from there, you were inspired to be like, okay, what can I do? And she went into the ask, which was become a volunteer with National Patient Advocate Foundation, so that you can also make your voice and your story heard, and you can be in front of those decision makers and those lawmakers who are crafting policy that can be sometimes harmful, but hopefully helpful and beneficial, and you can be part of that. So she really went through, here is my story and the collective challenge we face, whether you were a patient, whether you work inside the healthcare system, the choice in which people don't really know that these things exist. And if they did, they can really benefit from them. And if they don't, we're just going to keep sort of falling into these traps. And because of that, the choice you should make is volunteering with NPAF. So to recap, I am a super huge fan of utilizing, if you can tell by now, of utilizing storytelling, but it will take some practice. So I want you to, for homework, think about what your story can be and how you can craft that to tell it to another person, your friends, your family, your community, to get them involved with the volunteerism that you all are already doing with NPAF. Thinking about what is the challenge you all share together, what is at stake in that choice they get to make, whether they act or don't act, and if hopefully you convince them and they want to act, what is that opportunity that you're going to give them to take some of that action. So I am done with slides now, so we can take some questions if you all have some.
All right, thank you, Martine. That was such an insightful presentation. We do have a few questions coming up. One here from Mary Stabile in New Jersey, who's asking, I hear that body language is important when speaking or telling your story. Do you have any tips on this topic?
Absolutely. Great question. Great question. I often, and if you are like myself and live in Zoom land for a lot of my professional experience now in the last year and a half, you've probably looked at yourself more than you wanted to, as I have. But what I will say, it has really given me the opportunity to see, like, when I'm listening, what does my face look like? When I'm talking, I've realized that I talk a lot with my hands and I gesture a lot. And so I would advocate that you practice some of this, right? Think about what your story is, and then do it, whether it's in a mirror or on Zoom, right? And record yourself or look at yourself in the mirror as you're giving your story to see for yourself. Do I look engaging? Do I look compassionate? Is my body evoking the emotion that I am trying to portray in my story, right? Do you have a really inspiring story and like leaning in a little bit helps, right? Or do you have like a really like sorrowful story and your hands are sort of clasped in a way? Think about how does your body also convey the emotion that you're trying to get across without that adds to the story and doesn't distract from the story. I will say, if you're doing any of the lobbying, a lot of it is happening on Zoom now, or if you're having sort of Zoom meet and greets, or even if you're out in space with folks, if you sit on a chair that does this, don't do this when you're telling your story, right? Try to plant your feet, whether you're standing or sitting. Always try to plant your feet, because when you do this, people for some reason see it as like not confident, or maybe you're not really telling the truth, because if you're telling the truth, you would sort of sit center, right? So think about how can you practice telling your story and sort of taking inventory of what the rest of your body is doing, because you do want to sit in a confident stance, but you do want to add some character to the story if you're able, that enhances the story. So absolutely, body language does matter. So practice on your little Zoom reflection or in the mirror to see, when I'm telling the story, what is my body saying?
Very helpful. All right, so we have another question about engaging the community. So it reads, in my community, one of the major barriers in getting people to share their story is the discomfort they feel around sharing something so personal. So how can I gently empower people to overcome this?
Great question. In the same way that you have, right? Vulnerability is a little uncomfortable for folks who don't do it very often. And sharing something really personal, right? When you can get emotional, for some people that's embarrassing. And so being able to provide this kind of structure that I laid out for you all right now may be one of those ways for folks, for you to say, let's write it out together, right? Like, what's the challenge that you're willing to talk about that you were able to face, and the story behind it, and a short story, right? We don't need the full in-depth, in the weeds, like half an hour feature length film story. We need the like couple of sentences that just give us a sense of what happened and how do other folks relate to that challenge. And then go into the choice, right? And the choice is a much more inspiring and like encouraging and empowering space to be in, to say, here's what's at stake. If we do act, we can really benefit a lot of folks. And if we don't act, it's really going to harm a lot of people. And then get into the action, right? Which is something that you all who are training your volunteers or your community to share their stories should be able to provide some examples of what they can use, so that you are then coaching them through what are you willing to share and practice with them that still feels comfortable and is still powerful and is still authentic and true to them, without really having to dive really deep into that emotional space that probably holds some trauma still, as you're thinking about having them prepare that advocacy telling story. And it also helps for you to know your own and repeat it back to them, so that they see an example of how it can look, that it is still powerful, it is still authentic, but it is still sort of within that boundary that they can set for themselves.
Right. And actually, to kind of build off of that, there's another question here about how can I share my story without coming off as trauma dumping?
Ooh, great question,
Yeah.
particularly when we're in the healthcare space, right? It is often trauma we have for ourselves, or could trigger trauma that other folks have experienced, right? And so again, when you think about the structure, we don't have to go super in depth into the trauma piece that happened, because what you're trying to lay out is a framework for, this is this thing that happened to me, and I know it's happening to a lot of other folks. And what was the sort of impact on you that does, and be frank about it and be like, and there is some trauma that I'm dealing with in regards to this scenario, but what I want to talk about is, and sort of move, and what you want to do is just not leave people in that trauma space, right? You want to move them into the choice space, because the choice space is that like inspiration, empowering space, right? It's that space, it's that journey that allows you, and that's that transformative moment again, right? It's that journey that allows you to say, this thing happened to me, and yes, it had some trauma around it, but what I was able to do was transform that into power. And by power, I was able to take action, and here's the action I'm hoping you take with me. So the hope is that you're sort of still taking them on a journey to say, there is a way out of that trauma, and the way out of that trauma is this choice you have to make, which is hopefully take action with us. Because absolutely, you want to know that that is traumatizing for you, and for some folks to share that, and be able to process that, and however that looks for you. But the hope is that you're taking people on a journey from trauma to inspiration to action.
Right. And I think especially with storytelling, when, you might be in a situation where you're in front of a legislator or, some hospital system official, it might feel, nerve-wracking. So really the preparation from this training, I think, is definitely keys to, moving from the trauma piece to then the power and the action. So I'm sure everyone is taking good notes from today's session.
Yeah, and sorry, Nicole, I wanted to just add as well, this is Melissa, that acknowledging that emotion, I know Martine, you talked about it, I think is also incredibly important here, right? No matter if you're talking with someone in your community that you're trying to engage, or a policymaker, it's okay to acknowledge the emotion that you're feeling, because I think, again, it goes back to that slide that you showed, Martine, about, getting at the heart and the gut, because people respond to that. And I think, I'm thinking back to the times where we've had to coach some of our volunteers when they are sharing their stories, and our volunteers have gone through some really tough things. And I think our panel before, showcased some of that, but you're right, they transformed that, really talked about that transformative moment and really channeled it to the action that they're doing now. And I think we have time for one more question.
Sure. Yeah, so, okay, this is about tailoring stories. So the question asks, what are some tips I can use to identify how to tailor my story to different audiences? For example, not everyone can relate to a traumatic or negative experience. So how can I hook a legislative audience?
That's a great question. And I think it's going to take a little bit of practice and a little bit of time, because I think as you continue to engage in this space, you're going to have to test some of that, right? And you're going to have to test, how do I take this story and make it not necessarily universally relatable, but at least relatable in that values framework, right? And particularly, hopefully, for legislators, values are strong for them, right? And so when you're again able to connect it to something you know they value, opportunity, access, our future as a country, right? Their constituents. What is the value that you can connect that story to, that the story becomes then evidentiary support to that value, right? And so it's going to take a little bit of research to see, how does a legislator work? What are the things that are important to them? And then how do I utilize my story to connect with those pieces of importance? Is it financial? Is it business related? Is it security for their community, right? What is the thing that is important to them? And then how do you connect your story to that value? Even though they may not relate directly to your story, you can frame it in a value of safety or prosperity, right? Or access that you know is important to them, that then again connects you all in the heart, so that then they feel it in the gut.
Great. Well, thank you so much, Martine. It was such a pleasure having you join us from the West Coast. And really also appreciate you kind of leading by example here in, the story that you shared and being vulnerable. It definitely requires a lot of strength, but we're all your family here too. So I'm glad we can have this conversation.